Hello everyone. Today's video is questions on vaccines, around 20 questions which can be restructured into forming more questions. So the first question is vaccines given before splenectomy. Okay. So vaccines given before splenectomy are H influenza vaccine, meningococcal vaccine and pneumococcal vaccine, because these are encapsulated organisms. Okay, and all three cause meningitis. Okay, so these are capsulated organisms. Okay, and these vaccines are given before splenectomy: Hib, meningococcal and pneumococcal. And the way to remember is all three are capsulated and cause meningitis. Uses of BCG: TB immunization, that's the first usage. It has some protection against leprosy. The third use is it is used in bladder cancer, and of course it's used in tuberculin test. So use in bladder cancer is the one thing you need to remember, and it also has protection against leprosy. Live attenuated vaccines, so these OPV, rotavirus, MMR and varicella, these are vaccines against viruses and these are live attenuated vaccines. So the mnemonic is ORMMRV. Okay, ORMMRV, that is oral polio vaccine, rotavirus vaccine, MMR which is mumps, measles, rubella vaccine and varicella. So ORMMRV is the live attenuated vaccines mnemonic, and the bacterial vaccines which are live attenuated are BCG and oral typhoid. Okay, BCG and oral typhoid. So you can remember this as TB mnemonic. Okay, BCG, everybody remembers BCG is a live attenuated vaccine, but you also need to remember oral typhoid vaccine is a live attenuated vaccine. So T for typhoid and B for BCG. Polysaccharide vaccines: typhoid vaccine, pneumococcal vaccine and meningococcal vaccines. All three are available as conjugate vaccines as well as polysaccharide vaccines. Toxoid vaccines: tetanus toxoid and diphtheria toxoid. Killed vaccines: rabies, hepatitis A, pertussis vaccine, Japanese encephalitis vaccine, influenza vaccine and injectable polio vaccine. These are all types of killed vaccines. Now you have to remember this only, because there can be multiple MCQs where these are all rearranged. So this is the list of killed vaccines. Recombinant subunit vaccine: hepatitis B vaccine is a recombinant subunit vaccine. Conjugate vaccines: TCV, MCV and PCV, that's typhoid, meningococcus and pneumococcus. These you will remember. And Hib, remember that Hib is the component of pentavalent vaccine and it is a conjugate vaccine. So Hib, H influenza vaccine, is also a conjugate vaccine. Most serious adverse effect with DPT vaccine in the past was vaccine encephalopathy, but this was later found to be a myth, because this was basically the child had seizures because of Dravet syndrome. Okay, there was association found with Dravet syndrome. Okay, which is because of mutation in the SCN1A gene. Okay, this gene mutation and multiple seizures associated with the fever. Okay, but this was also associated with the use of whole cell pertussis vaccine in the past, and this has drastically come down after the usage of acellular pertussis component. Okay, so this was there in the past and now it's no longer there. Subcutaneous route of administration. Okay, this is used in MMRV, that is mumps, measles, rubella and varicella, and live attenuated hepatitis A vaccine. So hepatitis A vaccine is of two types. Live attenuated is given as a subcutaneous vaccine. Other ones are MMR and varicella. The killed hepatitis A vaccine is given by the IM route. Okay, the live attenuated is subcut, killed hepatitis A is vaccine is IM route. Intradermal vaccines, okay, fractional IPV is given in the government sector, which is basically 1/5 of the dose of the injectable polio vaccine. Okay, so 1/5 of the dose of injectable polio vaccine, this is given in government sector, that's fractional IPV, and that is given as an intradermal vaccine. BCG, we all know it is given intradermal. Rabies vaccine is actually given intramuscular, but in resource poor settings it can be given intradermal also, because less volume of the vaccine is required. Okay, so intradermal vaccines are fractional IPV, BCG and rabies vaccines. BCG vaccine is given in the left arm and by the intradermal route. Varicella vaccine uses the OCA strain of the varicella virus. Inactivated Japanese encephalitis vaccine uses SA14442 strain. Okay, Japanese encephalitis vaccine uses SA14442 strain. And Kolar strain, the Indian strain, this covers all strains that are present in India. Okay, Kolar strain, all strains of the Japanese encephalitis virus that are present in India. Quadrivalent meningococcal vaccine protects against these four serotypes A, C, Y and W135. Please note that B is not included. A, C, Y and W135 are included in the quadrivalent meningococcal conjugate vaccine. GBS, that is Guillain-Barré syndrome. This is a serious adverse effect of influenza vaccine. Vaccines that can be frozen are OPV, BCG and MMR or measles vaccine. These vaccines can be frozen. Okay. So OPV, BCG and measles vaccine. Vaccines that should not be frozen, okay, which lose their efficacy if they are frozen, are all the T containing vaccines. So remember this rule, all the vaccines containing T. So DPT, tetanus, typhoid, hepatitis A, hepatitis B. So all the vaccines containing T letter should not be frozen. Natural history of BCG vaccine is there's a wheel at around 20 to 30 minutes because this is an intradermal vaccine, so there will be a wheel generated over there within 20 to 30 minutes. Then that area, that region gets induration. Okay, there's induration in the 3rd and 4th week. By the 6th week, there is a lump formation. By the 8th week, there is an ulcer over there. And by the 10th to 12th week, that means by around 3 months, there is a scar formation. This is the natural history of the BCG vaccine. Mission Indradhanush, this covers 7 diseases like that of 7 colors of rainbow. So this covers 7 diseases, 7 vaccines. Okay, 7 diseases and 7 vaccines. So what are the diseases covered? So TB, hepatitis B, polio, these 3 are given at birth anyway. So BCG, Hep B vaccine and oral polio vaccine. Okay, these are given at birth. DPT is given as the next vaccine, that is 6, 10 and 14 weeks, right? 6, 10 and 14 weeks DPT is given, and measles is given at 9 months. Okay, so this mission Indradhanush, you remember at 0 day BCG, Hep B and OPV, 6, 10, 14 weeks DPT is given, and measles is given at 9 months. So that's all for today, guys. These questions can be reframed and asked in some other manner also. So make sure you are thorough with all the questions stated in this video.